My name's Victoria. I'm the Executive Director of the Culture, Health and Wellbeing Alliance. I'm a middle-aged white woman. I'm wearing a pair of black-rimmed glasses and I've got short brown hair. So we actually approached this as a consortium rather than an individual organisation, and our consortium was of arts and health alliances made up of the Culture, Health and Wellbeing Alliance, Arts and Health South West, London Arts and Health, and also the Network for Arts, Design and Heritage in Hospitals. So between us we have thousands of members all around the UK, most of whom are themselves using art, creativity, culture to help change health and wellbeing for the better. As networks, we're all interested in the intersections between the changing climate and health. For me, there are a couple of overarching reasons to think about health and climate together. Firstly, there are aspects of our current health systems, like pharmacology, for example, which are drivers of climate change. Arts and health, or creative health, if you like, is part of a wider effort to support health in ways that reduce dependence on these drivers. Second, the people who are most likely to have poor health are the same people most likely to be worst impacted by climate change. And arts and creativity are a way to critique this inequity and imagine what a healthy society really looks like. So for us as a consortium, this wasn't about doing a project ourselves. We know that there are lots of people within our memberships who've been working to these principles for decades. We wanted to understand more about what was already out there and where the barriers and enablers lay. We also wanted to give our members more confidence to talk about climate and health together, and to make it clear that this intersectional work they're already doing has important learning to offer the wider cultural and health sectors. What were our successes? What were the processes that drove them? We collaborated with Frances Northrop, who is a New Economics Foundation Fellow, and together we did a number of interviews, some analysis, and built a new climate, creativity and health resource online, which has all of this included, as well as bringing together relevant resources from the sector and beyond. As far as we know, this is the first such dedicated resource. But beyond the resource itself, the fact that we're overtly focusing on climate and have committed to an item in every newsletter, for example, with a climate focus, means that other things are changing. We've seen a small increase in the number of submissions to our annual climate award, for one, but we're also definitely seeing a more articulate and confident case for the connections between climate, health and creativity being made. This is probably the result of changes in wider narratives rather than anything that we've done, but it does suggest to me that people are recognising that there's a space within our networks to explore these ideas, especially perhaps for small organisations and freelancers whose work in this space doesn't usually get quite as much traction as the large cultural institutions. What didn't work, and what did we learn from it? The thing I find most challenging is gauging how much people are actually using our resource. At the time of the launch, we had about 350 page views. In the last couple of months, that's dropped down to under 50. That's not disastrously bad. The total views between the launch and now are probably about half of the total views for our research and evaluation pages, for example, which are really popular aspects of what we do. But it maybe reflects the fact that climate is not yet seen as a key concern for arts and health. It could also be that in its current form, the resource isn't that useful to people. The biggest issue we have at the moment is that we don't have any dedicated funding to pay more attention to it, to refine it, to seek proper feedback and so on. And we're a collection of very small organisations. How has the Accelerator programme impacted our organisational sustainability and approach? I think the main thing is that the programme has legitimised our work in this space, which is really important because just as our case studies told us, this kind of intersectional thinking and work can be quite tricky to find funding for. We're used to thinking of these things as silos, so health is here, climate is here, social justice is over here. So having a bit of space to think through the reality of the fact that these things all operate together is really important and useful. The other thing is that it's encouraged me personally to try to keep foregrounding climate and social justice in our work. It's been really helpful to talk this through with colleagues in the cohort and with Julie's Bicycle staff, and the guest speakers that Julie's Bicycle have organised have led to other partnerships for us as well. I think really most importantly, being in this cohort has given us the space to think through these ideas and come up with a position statement, and that's now governing our work in this area. I'll read that out now. Climate justice and health equity are urgent, intersecting issues. Climate change impacts everything from mental health to respiratory health and affects people unequally. Many creative freelancers and organisations already take a holistic approach to health in relation to community and environment. We believe that as more and more people do this, we will be able to imagine new futures, empower change makers, demonstrate sustainable organisational practices, and reduce demand on polluting and energy-hungry health services. We want to help creative and cultural practitioners directly address the connected issues of climate change, environmental degradation, and public health. We're particularly interested in accelerating work that creates concrete change at a local level. So what next? We're trying to thread a climate focus through all of our work, so we'll be part of the new Creative Health Quality Framework, for example. And we'll continue to hold our climate awards. We've done a brief analysis of those. And we're working with a student on the UCL Creative Health Masters at the moment to develop some more case studies in this area. As I say, I think there's more we could do to make the resource usable and relevant. We may need some more funding to do that, to connect it with some training, for example. So this is all evolving for us.